Hi, thanks for joining. Today we're doing some swallow strengthening exercises. My name's Kylie. I'm a speech language pathologist and I have worked with stroke and brain injury patients throughout my career and I really enjoy it. So I've made a bunch of different follow along exercise videos that you can follow along with. But today we're focusing on strengthening the swallow muscles. Just a quick reminder before we start, all of these are general exercises and you should be working with a licensed speech language pathologist to assess and treat your swallowing. These are just things to help complement the care that you're already getting. Today we're talking about how to strengthen those swallow muscles. I'll take you through a quick workout, but first I want to quickly explain what difficulty with swallowing might look like. After a stroke, these muscles in our mouth and our throat might be affected, maybe weaker or not as coordinated. If this is happening, it's called dysphagia, which is a swallowing disorder. The reason we care about swallowing is it happens to us all. When we're eating or drinking, we cough or we feel things go down the wrong pipe. So that just means we have our esophagus, where all of our food should go to our stomach, and we have our airway, which goes to our lungs, right? So what we don't want is things going down the wrong pipe, down to the lungs. That can cause infection in the lungs, such as aspiration pneumonia. So we want to prevent things from going down the wrong pipe, which is why we're trying to strengthen those muscles so things are going down the right way. Now, most of the time, our body tries to tell us when things are going down the wrong way, meaning we cough or throat clear, or your eyes get watery, or your oxygen saturation decreases. But sometimes those nerves are not responding as they should be. So those are some of the common signs that you might have difficulty with swallowing. Today, let's focus on ways that we can strengthen those muscles to decrease the chances of things going down the wrong way. Something to know about improving swallowing is that swallowing improves swallowing. So the more you practice, the more those muscles get stronger and more coordinated. The first exercise we'll do today is called Effortful Swallow. This just means you're swallowing really hard. I tell people to imagine trying to swallow and squeeze those muscles as tight as you can, as if you're swallowing a golf ball or something. Imagine that force. So we're going to do this together. I want you to sit upright. I'll move my hair so you can see. We're working on strengthening these muscles. We're going to swallow 5 times as hard as you can, engaging these muscles. Ready? 1, 2, 3, 4, 5. It's okay to take breaks in between. Sometimes it's hard to start that swallow. Okay, the second one we're going to be doing is tongue to the roof of your mouth. We're trying to strengthen this tongue muscle. So you will just take your tongue and press it to the roof of your mouth. Like that. We're going to do it 5 times. Ready? Sitting up tall. Taking a deep breath in before. 1, 2, 3, 4, 5. The third exercise is called the Masako. What we're going to do is stick out your tongue and using your teeth to slightly hold the tongue in place. You're trying to strengthen the back of the tongue, the base of the tongue. That's really important for swallowing. So I'll show you how, just like this. Tongue out and putting your teeth on your tongue to hold it in place, and then you'll swallow. We'll do it 5 times. Ready? 5. Take a quick sip of water. Okay, our 4th will also be strengthening the tongue. We're going to pretend you have peanut butter on the top of your mouth, and you're going to be pushing your tongue up and licking the roof of your mouth like you have peanut butter stuck. We'll do it 5 times. Ready? Breathe in. Five. These are 4 basic exercises that you can do when you're sitting down and watching TV or before a meal. Anytime you can connect these into your routines, it helps build that consistency. Now feel free to go ahead and rewatch this video to do another round. I recommend you do about 3 rounds, and it just depends on where you're at. We did 5 reps. Always feel free to do more. You can always make sure to take breaks in between and go at your own pace. Now, when you're eating or drinking, there are a couple things I want you to remember. Some swallow precautions, right? So when you're eating and drinking, making sure not to talk, reducing the distractions. So probably not watching TV, right? Taking small bites and small sips, going at a slow rate, making sure you are sitting upright at a 90-degree angle for the meal, and then after the meal, make sure you stay upright for 30 minutes. Those are just good swallow precautions to reduce your risk of aspiration, things going down the wrong way. Now, try these exercises 1 to 2 times a day unless your therapist has recommended something else. Even a few minutes of consistent practice can make a big difference over time. If this was helpful, I'll be making more follow-along videos just like this, so make sure to like and subscribe so you can follow along and build these into your daily routine. I've also made a lot of really good free resources. Make sure to check them out in the description, including 10 things you should be doing daily to support your stroke or recovery. Thank you so much for joining me today. I appreciate your time, and I hope you have a great day. Aloha.